Hello, I'm Nikos Salingaros. I'm going to briefly mention some points about the recent paper that I published in Challenges with architect Marco Aresta, who works in Argentina. We discussed the unsuitability of interior spaces and the design that comes from the architecture profession and why those spaces are unsuitable. This has been an academic discussion for many decades, but it was really brought to crisis proportions because of the COVID lockdown, when the entire world had to spend, and is still spending, 1.5 years locked up inside their living spaces. And we have seen many scientists gather data as to the unsuitability, psychological and physiological unsuitability of interior spaces as they have been designed over the last century. Specifically, I'm going to criticize the modernist industrial aesthetic that has been in place mostly all over the world since the 1920s, and especially after the Second World War. That design priority gave sterile, colorless, cramped spaces throughout the world at the same time that the profession, in a shameless lack of professional understanding, promoted these spaces. And the spaces are not very good for the people who live in their own houses or work in such an environments. We have the latest scientific data that show that those spaces create anxiety, and of course anxiety over the long term creates physiological disturbances and leads to serious illnesses. The worst victims of this sort of design approach are children. Such spaces as are prioritized by the modernist industrial aesthetic are absolutely terrible for children. The children find themselves in a hostile alien environment. It is unthinkable why professional architects have totally ignored the child's realm for over a century and keep producing these terribly hostile places for our children to grow up in. As if this were not enough, now the latest evidence shows that babies born during the COVID crisis of the last 1.5 years that were tracked show a markedly lower intelligence and other development of their brain. And this is a shock. It is being discussed in the medical profession. We refer to it in our article. Of course, we are not doctors. We cannot interpret that. However, we put two and two together. We can join the dots. And we strongly suspect that the environment, the minimalist environment that we see all over the world over the last century could be a contributing factor to this terrible event that is being measured by doctors. This is very, very recent. So I mentioned in the article with Aresta, published in Challenges, and I have also been asked to write a popular article that was published in the Critic, a UK London magazine.